Good morning to all. Myself Surendran, nursing tutor, Department of Medical Surgical Nursing from ES College of Nursing, Villupuram. So now we'll discuss about the admission and discharge procedure from the hospital setups. So it's a very major and it is a basic now from the nursing students. So first we'll see the hospital. Yeah, the hospital is a place where the people who are ill are looked after by a nurse and doctors. So the hospital, it is derived from the Latin word hospitals. So it turned from the derived from the French words. It is the hospice. It means the guest or host. A hospital is an institution. It is an institution to providing the medical and surgical treatment and the special nursing care for the sick and injured peoples. So next we'll see the definition of the admissions. Admission is defined as allowing a patients to stay in hospital for observation, investigation, treatment and care. Admission is the entry of the patient into a hospital's ward for the therapeutic and diagnostic procedure. So admission is a basic procedure from the hospital setups for each and every patients. So it is allowing to the patient to stay from the hospital setups. Why we have stay the hospital setup means to observing the patient and getting the investigations and get the diagnostic, and we have giving the treatment for the patient and cure the disease and prevent the disease for the patient setups. So admission is the basic ones. Admission is the entry of the patient into the hospital and ward therapeutic from the diagnostic purpose. So next purpose of the admission. So first purpose is to undergo the evaluation and the treatment. So while patient the admission, so that time only we have correctly evaluate the patient and we have give the treatment from the patient at the correct times to know what is really happen in his or her body, right of it is to be fixed, to provide the emotional security to the newly admitted patient and his family members. So while admitted the patient, we have supporting emotional, spiritual to the patient and also patient family members. So next we'll see the types of admissions. There are two types of admission. One is the emergency admission, one is the routine admissions. So first we'll see the emergency admissions. So emergency admission means it is a patient are admitted in acute condition requiring in the immediate treatments. So for example of the emergency admission persons are patient with the RTA. RTA means it is a road traffic accidents and poisoning cases, burns and cardiac or respiratory emergency. So these are all the patient unders will admitted from the emergency admission. We have they are having the immediate treatment for the patients, requiring the immediate treatment for the patients. And routine admission, in these patients are admitted for the investigation, diagnostic and medical and surgical treatments. Treatments is given according to the patient problems. For example of the routine admission patient are with hypertension, diabetes mellitus, non-communicable disease patients. So these are all the patients will take the continuous treatments. So that's why we have admitted the routine admissions. So unit of preparation. Before we have admitted the patient, we have prepare from our unit to the correctly. It is it is a place whether the patient is kept during the hospital stay. The admitted department notifiable the unit prior to the patient arrival so that the room bed can be prepared. Before the patient will arrive the unit, we have prepared everything in the unit setups like the cot and all the emergency equipments and also we have prepared medicines at all. Preparing the treatment tables, ensure all the equipments are completely. We have checked each and every equipments while it is working or not working. Every shift we have checking, and we have checking the all the equipments like cords, defibrillators and respiratory ventilators at all. checking the ventilation from the units, and ensure the patient privacy. So these are the preparation before the patient will arriving. We have prepared for the unit setups. Next, admission procedure. Meet and receive the patients. First, we have meet and receive the patient from the another departments. Verify the patient data by checking the record sheet and the chart. Before we have admitted the patient, we have verified the patient details like history collections and the family histories and socio-economic status. All the histories, all the general histories we have verified, and after only we have admitted the patient from the hospital setups. Introducing immediate personnel. So we have while admission the patient, we have introduced to yourself. From first thing, we have introduced yourself to the patient sites. So then only we the patient will explain all those things. Assist the patient to the treatment areas and ask the patient to change the cloth into the hospital gowns if necessaries. So we have before after the admission of the patient, we have given the hospital cloth to the patient sites to changing the hospital cloth into the their own cloth. It will be replacing their patient family members. Recording and reportings. First one, admission books and preparation of the paper, drug book, diet book, HMIS entries and the court. HMIS is means it is the hospital management information system entries. So before after the admitted the patient, we have get the signature from the admission consent form and patient after the admission the patient, we have next we will see the MLC. MLC means it is a medical legal cases. Medical legal cases is defined as any cases of injury or ailments, whether they attending the doctor after the history taking and the clinical examination considered that investigation by the law enforcement agencies and also the superior military authorities are warranted to a certain circumstance or fixed responsibility regarding the said injury or ailments according to the laws. So example of the MLC case means like accidents like road traffic accidents, cases of trauma with suspicious of foul place, electrical injuries, poisonings, alcohol intoxications, burns and scald, sexual offense, attempt suicides. So these are all the patient will admitted the hospital before we have informed to the police from the hospital from the police stations. Roles and responsibility of the nurse in admission procedures. The first thing, the nurse should deal every effort to be friendly and courteous with the patient and the family members. So we have admitted the patient from the hospital setups. We have introduced self-introduction to the patient sides, and we have deal with friendly and courtesy. So that's why the patient will get so most of the patient will get anxiety and fear about the hospital setups. So we have give the emotional support and dealing with the friendly from the hospital patient sides and also the family members also. Make sure the proper observation of the patient condition. Each and every 1 hour we have check up the vital signs. We have observed the intake output charts and monitors at all. Orient the patient and the relatives regarding the hospital policies. After the admission procedure, we have orient to the patient and their patient family members regarding all the policy setups, and deal with the patient carefully who is suffering from the communicable disease or illness. Isolate if necessary. The patient under the communicable who are all suffering the communicable disease, we have arranging the isolate for the patient, because we have prevent the communicable disease from the one patient to the another patients. Patient valuables and cloth should be handed over to the relatives with the proper recording. So we have handovering the patient own clothes, jewelries, and mobile phones and specs at all. We have handovering to the patient family members and get the consent signature from the patient and also patient family members. It is helpful for nurses. Next we'll see the discharge of the patients. For definition, discharge of the patient from the hospital means relieving a persons from the hospital settings who admitted as an inpatient in that hospital setups. Types of discharges: planned discharges, Dama or Lama, transfer, Abscond, referral. So first we'll see the planned discharge. The patient complete the initial and actual management in the hospital, and now he or she needed to be the under direct supervision of the hospitals. Planned discharging means it is a completely curable from the patient sides. They have the management and the hospital setups needed to discharge under the supervision of that hospital. That is a planned discharge. Dama and Lama means it is a discharge or leave against the medical advice. And next one, transfer. Transfer means it is a transfer to one unit to the another hospital, another unit or another hospitals. And abscond from the hospitals. And referral means it is a referral for the further management from the one hospital setups to another hospitals. Discharging planning. The nurse play an important role in the discharge planning in the hospitals. Continuity of the care is important. To achieving the continuity of the care, nurse use the critical thinking skills and applying the nursing process. Discharging plan is centralized and coordinate interdisciplinary process. The first point is a nurse plan an important role in the discharging plan in the hospital setups. Before we have discharging the patient from the unit means we have intimate the another unit from the patient details. Then only the people having arranged all the equipment from the patient needed from the patient setups. Continuing the care is very important. After the patient discharge from the hospital, we have follow-up care from the patient sites. And achieving the community of the cares and nurses using the critical things. Discharge planning is not only taken from the nurses, it is a centralized one. It is coordinated from the other other healthcare personnel like doctors, pharmacists, and therapists. So these are all the will consider and will get the discharging planning from the patient sides. So next, discharging planning. The patient and the family, medical staff, nursing staff, social workers, dietitian, all the work together coordinate and discharging the patients. The doctor plan the discharging with the patient and leaves the written order on the patient charts. While the patient planning to discharging means while the doctor will be written order from the patient chart. The nurse's responsibility during the discharges. Planning in the beginning, plan for rehabilitation and follow-up needs, teach the nursing procedure to be continued at the home, get it is the practice done, arrangement for the transport. Discharging procedures. Seeing the doctor return doctor order, explanations, hand over the personal belongings, checking the check and receiving any hospital properties, confirming the bill paid, inform other department regarding the discharge and arranging the transport. These are all the discharging procedure. First we'll see the doctor's order, written orders. Next we'll explain the discharging from the patient and also the patient family members, and we have handovering all the personal equipment belongings to the patient family members and check and receiving the any hospital properties and confirming the bill paid and through the account sections and inform all the department regarding the patient discharges. And finally we have arranging the transport from the patient sites. Dama means discharge against the medical advice. We have checked the consent. we before the Dama we have check the consent and do all the Dama properties. Next, nurse's responsibility to discharge. After discharging the document, we have preparing the discharging documents and submitted to the nursing supervisors and care of patient room and articles. The nurse's responsibility in the MLC discharges. Discharging the check of the medical legal histories, notifiable the nursing medical officer in charges. Abscond cases immediately the contact the nursing officer in charge, medical officer in charge. Maintaining all the documents in a proper manner, take a written handing over and taking of articles. Never discharges patient without the written order by the physician. Thank you.